Hi, my name is Angela and Zina, and I'm going to be walking you through how to do a PICC line dressing change. You want to gather all your supplies and go into the patient's room. Clean the table where you're going to put all your supplies so the area is sterile and clean. And you want to talk to the patient and ask them their name, date of birth, if they have any allergies, especially to chlorhexidine that you're going to be cleaning them with. And then once all that is set and squared and out of the way, you want to give them just a regular mask to put on. You can have them turn their head away from the dressing change, but you know, this procedure can take a little bit long for patients to keep their head turned one way. So this way they can still turn their head either way and talk to you as well. And you want to put a mask on for yourself. So after you identify the patient, their allergies, and put masks on, you want to hand hygiene before you touch any of the patient. Once you hand hygiene, you want to put on a set of clean gloves to remove the dressing. So this is what the dressing is going to look like, you know, give or take a couple things. You're going to want to measure from the insertion site down to the end of the PICC to get a number to make sure the PICC 1 hasn't moved at all during care, and to not move during the dressing change. You're going to want to get an alcohol swab to help remove the old dressing and make it less painful on the patient as well. So once you do that, you can wet around the edges and it'll help pick up the dressing. And when you are picking up the dressing and removing it, you want to hold down the PICC line to secure it. That way you're not pulling it out as well. Once that is off, you are gonna, this little device underneath tends to not get changed. Sometimes there is a securement device that can get changed. We'll act like there's a securement device underneath of it. So if there is a securement device underneath of this, then you can take that securement device off as well. Once all that is removed, then your dressing is going to look, then your PICC line is going to look something like this. It's just going to be an open line on the skin. So once you get to that, you want to take off your clean gloves and hand hygiene and put on your sterile gloves. So I'm going to now face this down so you can see. So this is my sterile area. And then my patient is right here. So you're going to hand hygiene and sterile gloves. For this demonstration, I have it set up like this, but normally the patient would be in front of me and my supplies would be next to me on a table. Okay, so now I'm sterile. Everything in here is sterile. So once you have no dressing and you have your sterile gloves on, you want to take your chlorhexidine. This chlorhexidine activates once you click the sides, and it'll activate the pad up here. I'm not going to click it right now. but you would click the sides and you would clean the area. You want to clean up and down for 15 seconds around the site, and then sideways for 15 seconds around the site. You do want to give it some friction, that way to make it all clean. And you do want to clean the line as well, top and bottom. Once that is all clean, you want to let that dry. It may take up to 2 minutes to dry, but you want to make sure that that is not wet when you put the dressing down. Next, you want to take your skin prep, open it, and apply it to where all of your adhesive is going to go. Around the site, underneath the site for the securement device, and that's going to take a couple minutes to dry as well. Once that is dry, I don't have a securement device in here, but once that is dry, you're going to place the securement device underneath the pick line. Sometimes it'll click in. This one doesn't have the wings on it to click into a securement device, but just imagine that it did. It would click into it, and then you would adhere it to the skin. So once that is adhered to the skin, you want to take your Tegaderm, peel it apart, and place it over the securement device, the line, and the insertion site. And you want the insertion site in the middle of the window so you can see if there's any complications. On your pick dressing Tegaderm, there is a little peel away part that you can initial and date it, and if you inserted it, put the gauge of the pick line. So once that is on, it'll look something like this again. And you want to take the extra tape that may be in there and secure it down right here as well. Once you are done, you want to clean up all of your area. If you didn't have a trash can next to you, to dispose of it as you were going. You want to ask the patient if they have any pain or discomfort. You want to measure the line again to see if it had moved when you put it, put the new dressing on. And you also want to make sure the patient remains in a comfortable position. So if they need to be placed in a comfortable position, you would place them there. A dressing change is done at least once a week. Or if there is any complications noted underneath of it, if there's some bleeding to it, then you can redo the whole dressing as well before it's due, and that would be your new day to do the dressings. Thank you.